Okay, I have a patient that is post-op cabbage patient. He weighs 165 pounds, which is 75 kilograms. He has a history of lung disease. He does follow commands. He smokes 1 pack of cigarettes per day for 10 years. He is already on SIMV, PRVC, which is pressure support, SIMV control on the ventilator. He is on a tidal volume of 650, rate of 10, PEEP of 8, and the flow is 50, with pressure support of 10. The breath sounds is stated that they're clear. Suction and x-rays show that there's patchy air, there's a little froth, maybe a little bit of blood, but decreased volumes, and the nurse will give Lasix for that to help. First thing I need to do is the patient's chart, look over it and see everything that's going on, make sure that he meets the standards of being weaned. Hemodynamically stable, the patient is, pulse rate looks good, cardiac output looks good, free from seizures, temperature looks good, the patient has no sepsis. Hemocrit is normal, which is above 25%. The patient is hydrated, very good nourished, has eat very good. The electrolytes is within normal. The patient is no pain, and the patient had very good sleep, which very good rest overnight, so be prepared to start this weaning trial. The patient doesn't seem nervous. The patient's bowel movements stated that they're good. So right now the nurse is saying that the patient is comprehending and is following commands, lifting, using body muscles. So I'm going to go in and I'm going to check and see if the patient can do some exercises for me. I'm going to gather my equipment, which is a stethoscope and a NEF manometer, and then I'm going to go in and start the exercise of the weaning process. Knock, knock. Hi, I'm Christy, respiratory. I'm here because your doctor has ordered that he wants to try to do some exercise to get you weaned, to get the tube out. I wash my hands. Identify. Giovanni Williamson. Okay, and the date of birth is right. Okay. Like I said, what I'm going to do is we're going to do some exercises to try to get this tube out. The exercises might be a little bit uncomfortable. Before we start, I'm going to go over a little bit of things for you. If the exercise, if it gets painful, short of breath, you just let me know, because you just had some surgery and it might be a little bit uncomfortable for you. But I'm going to listen to your breath sounds to make sure all that's good and suction you a little bit so nothing will interfere in doing these tests. Okay? So I'm going to suction. It's going to be a little bit uncomfortable. Hold your stomach in case you cough and have a little bit of pain, okay? Okay, it's just a little bit of blood, but it's clear. It's nothing. You had a little bit of edema in there, and the nurse is going to give you Lasix to help with that. So that won't be no problem, okay? I'm going to listen to your breath sounds. I'm going to listen to 4 on the front, 4 on the back, 2 on the side. And you sound good. You sound real clear, okay? So I don't see no problem with doing these tests, but like I said, you're uncomfortable with anything as doing it, you just let me know. The patient's vital signs look good. I will swap her over to pressure support and CPAP, but before I do that, I want to make sure the blood pressure's good. The respiratory rates is good. She's breathing good. Her O2 is good. I want to make sure it's in normal levels before we start this test. Okay, it looks like the patient is breathing good, respiratory rates of 12 to 25 breaths a minute. Looks like the minute volume is less than 10. It looks good. Her RSBI is less than 105, which is good based on her rate, and her weight, like I said, 75 kilograms. Her spontaneous tidal volume, and that looks good, right along with her spontaneous rate. I did do the crop ratio, and on her ratio in which is greater than 13, I got 25 based on her weight and the calculations that I have got. Her tide volume was 2100, which it needs to be. So when I do these tests, we got to make sure we do get over what she needs to get. Okay, so I'm on pressure support. I'm going to leave her on pressure support for at least five minutes so I can monitor her to make sure she can handle this pressure support. Pressure support and CPAP that I'm putting you on, the machine is not going to breathe through you anymore. You're going to have to breathe on your own. So I'm going to sit here and monitor and make sure that you can breathe on your own and all your vital signs and everything looks good, okay? Okay, so everything looks good, so we're going to start this test. The first test we're going to do is I'm going to ask you to take a deep breath in, and I'm going to ask you to blow it forcefully out, and then you will start breathing normal again, okay? Alright, are you ready for this? But before I do that, I want to make sure that you can you lift your hands for me? Can you lift your head? Okay, you got good muscle. I wanted to make sure that you are comprehending what I'm saying and that you can, you know, have some muscle use. Okay, this test that we're doing, I'm going to ask you to take a deep breath in. I need you to can you take a deep breath in for me? Blow it out forcefully. Blow, 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 blow. Okay, breath back in and breathe normally. Okay, she did good on the test. She did 2100, which is good for her weight, her body weight that I calculated. So we're going to start to the next test, which is the nip test. Okay, on this test, I'm going to ask you to suck in like you're sucking through a straw. You have a milkshake and it's going to be hard to suck in, but you just suck in, okay? Then I'm going to ask you to blow it out and breathe normal, okay? Alright, and while you do that, I'm going to hold the expiratory hold button. Okay? I need you to take a deep breath in. I'm going to hold the expiratory hold button. Okay. Blow it back out. There you go. Bless you. Okay, just breathe normal for me. Okay, she did good on that. She did get a -30, which is in limits. She did pass that test. Really good. Okay, you did really good on your test. You passed them, so what I'm going to do, I'm going to leave you on CPAP and pressure control for 2 hours. I'm going to come and monitor you to make sure you are, you know, working with this CPAP, so we can call the doctor and tell them that you passed everything and you are doing good on CPAP, so we can get you, you know, this tube out of you. But I want you to just relax, okay, because you don't want to work your body up, so, you know, it'll stop this process, okay? So I'm going to come back in 2 hours after I talk to the doctor and everything, and we're going to see how she's doing, and we'll see if the doctor wants to, you know, go ahead and go with the extubation. Okay, it's been 2 hours. I'm back. It looks like you're doing really good. It looks like everything's in normal. Your respiratory rate looks good. Your sat looks good. Blood pressure's looking good, and you look like you're doing pretty good breathing on your own. So what I'm going to do is to let the doctor know, and we're going to try to get this tube out of you. Does that sound good? All right, before I do that, I want to listen to your breath sounds again, okay? And make sure, you know, everything still sounds clear in there. So I'm going to listen to the breath sounds, 4 on the front, 4 on the back, 2 on the side. It looks really good. So we're going to let the doctor know, and we're going to get this tube out of you. And I'm going to wash my hands.